Right now, there are signs that it's moving down as a transmission, but not necessarily on the hospital situation. So we have to be careful.
Quebecers will need to keep these masks on a little longer. Public Health recommending to the Legault government that the mask mandate be extended until at least mid-May. This as cases, deaths, and COVID hospitalizations continue to rise. But Dr. Luc Boileau saying transmission of the virus seems to be slowing.
We've said that we've recommended it because there is still a real pandemic situation right now in the Quebec. It seems to be not as worse that it was a week ago, but it's still very heavy. So, and the data coming from Cyrano is still showing numbers of over 30 to 50,000 persons per day. So it's still really active. We have to be careful with that. And if the numbers are really showing a drop, then we can revise our recommendation to the government concerning the obligation of the mask wearing.
Dr. Boileau warning that Quebecers need to remain cautiously optimistic and vigilant as not to burden an already overrun healthcare system.
There is about 2,400, maybe we'll reach 2,005 in a few days, but it should not get really more than that. And on the intensive care unit, it's still around or less than 100 beds, which is great right now. And Dr. Patani said earlier that only 5% of the cases are moving to the intensive care unit, which is really different from the other waves and which is great for the health system because it's really challenging everywhere in the hospital, but especially in the intensive care unit.
With close to 11,000 healthcare workers still missing from the network and in the middle of a full-blown flu season, Quebecers should do what they can to avoid visiting ERs.
It's the first time since the beginning of the pandemic that we have both COVID as well as influenza really at the same time in people. As Dr. Boileau mentioned, both conditions have very much overlapping symptoms, and both are being seen in the emergency rooms and are causing an additional strain on the emergency rooms.
Dr. Boileau urged seniors and the immunocompromised to get their third dose of vaccine, saying it protects against severe illness from COVID-19. Rates for third shots seemingly stalled at 54%.
Having had 2 doses is still something that is quite good, but not as good as 3 doses. And we have to follow the science with that and recommend it to be taken.
Public Health also changing isolation periods for immunosuppressed individuals with COVID-19 symptoms, reduced from 21 days to 10 days. In Montreal, Felisha Adam, City News.